What's going on in Clay County, Georgia? Access to care and chronic diseases. A presentation and a program by myself, Justin Dixon, Jessica Jones, and Yana Robertson.
So Clay County is a rural, low population density county in Georgia that actually borders the state of Alabama. Georgia is split into 18 public health districts. Clay County is located in district number 7 of those 18, or the West Central District. The little guy in the corner is a barn owl, which is actually fitting for our rural area and easily found in Clay County. Next slide, please. So, Clay County residents are notoriously known for being unhealthy and high risk due to social behaviors. The image on the left is a depiction of Clay County, which includes Fort Gaines as well as Bluffton of Georgia. The majority of the map markings are located in Fort Gaines, as that is the most marketable and populated area of the county. So, right now, I would like to draw your attention to the image on the right, which is comparing state, national, and Clay County residents. So overall, Clay County fares worse than that of the state and or national average, including mammography screenings, PCP, dental, and mental health provider to patient ratios, housing problems, as well as exercise opportunities. Next slide, please. Okay, so the environmental and social demographics follow the same pattern as the previous stats discussed. Clay County residents have lower educational statistics, higher unemployment and poverty rates, as well as higher rates of childcare costs. The image to the left is the logo for Clay County Public Schools. If you notice at the top, it reads, "In God We Trust." Most residents are religious who are affiliated and participate with a local church body. I'm going to turn it over to Yana.
Thank you. As an unhealthy region, Clay County is ranked 144 out of 159 Georgia counties, and more than a third of adult residents report disability with the functional limitations. According to 2020 data, the leading causes of premature death in this county were cancer, cardiovascular, and respiratory diseases. Obesity and the mental disorders add to the burden of chronic conditions that severely affect this community. The demographics and the data here show a direct correlation as why Clay County struggles with access to care and suffers from an increase of chronic diseases. Next, please. In addition to the burden of chronic conditions, Clay County is very limited access to care. The only hospital in the Clay County was closed in 2020. Only 2 small medical clinics do not provide enough care to the struggling residents. Lack or limitation of transportation is another barrier that also restricts access to care. There is no bus or train stations in this county. Limited education opportunity impact risky health behaviors such as inactivity, smoking, and susceptibility to chronic illnesses. There's no high school or colleges in this county. However, there's a elementary and a middle schools. Thank you. Next.
So Clay County has 3 separate boards, one representing the county as a whole, and the other 2 representing the city of Fort Gaines as well as the town of Bluffton. Board members and area stakeholders consist of county commissioners, city and town council members, as well as local citizens to best promote for and suit the needs of the communities. The asset maps that you see on the slide show the triangle of healthcare facilities, the elementary and middle schools, grocery stores, gas stations, and other essential facilities and organizations, including the local health department. Another rather important extension of our asset map is the Bagby State Park, as well as the Red Clay Barn Quilt Trail, which can provide the residents a place for meditation, relaxation, as well as exercise opportunities. And speaking of opportunities, I'm going to turn it over to Justin.
By developing a Clay County Chronic Health Conditions and Access to Care Coalition, this would be a 12-month county and community-centered approach plan. This coalition would focus on the LAMP model, which includes the lived experiences, academic expertise, moral wisdom, and professional experience. The learned wisdom part of the coalition would focus on using the voices of the residents within the county and utilizing their lived experiences. The coalition would host 3 to 4 sessions to collect information. Additionally, 5 or more local residents would be trained who would provide a lived experience and volunteer as an educator. Academic expertise, including clinical faculty from the Mercer University School of Medicine, would be utilized for the necessary support and oversight for the research, development, and evaluation of the overall success of the plan. The coalition could benefit from joint partnerships with Georgia universities as well as community colleges. Moral wisdom would allow for input from the faith communities and allow for moral and ethical leadership. By inviting religious figures of the community to participate in separate roundtable events to both gather and disseminate information, this would provide a potential sounding board during religious events led by religious leaders to send out messages to the community. This will allow for the direct messaging to the community that the coalition is rooted in providing access to care, that it needs to become a community shared responsibility. Professional expertise will include local, district, state, and federal leaders of government and businesses to assure financial, structural, professional, and many other forms of support. The coalition will create a recruitment and retention campaign that will be centered in an area of the state that has access to many healthcare providers. The coalition will enlist the healthcare providers to provide expanded delivery of healthcare services. The goal will be to either onboard per diem providers or identify those looking to relocate with the option to weigh in and focus on improving the county. We would aim to achieve a 65% provider recruitment by July 2025.
To improve access to care, the coalition strategy is to increase the healthcare providers' workforce. Additionally, to organize mobile healthcare units to reach out to the communities in need in the more remote areas. The program will also utilize available school buses for transportation to healthcare centers during the school in progress hours. Home visits may be considered for single parents or elderly, non-transportable, or otherwise physically dependent residents. Participate in local churches will be equipped with the computers to offer community webinars and utilize additional telehealth care access. In addition to attracting tourists and bringing in revenue to the county, the utilization of natural resources will improve with improved parks will allow local members of Clay County to enhance their physical and mental health. Next.
Quantitative and qualitative metrics are necessary in order to evaluate the impact of a program on community health. Quantitative analysis will be an analysis of numerical data that is measurable to demonstrate either improvement, decline, or stagnation. Qualitative metrics are interpretations of improvement or decline or stagnation based on quality of life, resources, and access to care, or the state of chronic conditions for the county. Metrics that can be used to measure the success of this project include physician visit data once providers are established in this county. This data would be available by comparing the number of residents in the county to the number of patients being served by the health clinics. Surveys are often included in the qualitative metrics because they are personal interpretation of a metric as opposed to a numeric measurable value. Surveys will be a vital portion of this by conducting them before and after the initiation of the project to measure the program's overall success. The coalition will be responsible for focusing on education in the community, and educating faith leaders will be necessary in order to maintain the program after the 12-month trial period. The coalition will need to be able to access funding from the state and county, as well as potential grants in order to continue the upward momentum. If these areas are focused on and utilized according to plan, then this should be a very sustainable program. However, if the funding or focus loses sight of the improvements of access to care in chronic conditions, then the program may fail. The coalition will need to appoint a program leader who feels very passionate about the issues and wants to succeed as a county and community leader. Otherwise, the improvements may stagnate and never improve to the state's overall healthcare averages.
As we mentioned before, the Clay County residents rank below the average in several healthcare factor areas, including many residents living below the poverty level. And here's just a couple of pictures of their main towns, Fort Gaines and Bluffton, and their modern living.
So these are the references that we utilized in order to bring this presentation to you today. Next slide, please. And we hope that you learned a little bit about our future plans for Clay County, Georgia. And should you have any questions, please feel free to reach out to us. And we do thank you.